Hello, welcome to my channel. In this video we will talk about some facts and information about diagnosis of vaginismus. Dyspareunia or painful sexual intercourse is a problem that many couples have to deal with at some point in life. One of the main reasons why couples, especially women, experience pain during intercourse is vaginismus. It is a kind of dyspareunia, which owing to its complexities is often misdiagnosed. If you are also someone who is experiencing dyspareunia, then you should be cautious as you may have developed vaginismus. The first step towards treating vaginismus is its proper diagnosis. Here, you will find all the necessary steps that will help you to have a proper diagnosis of vaginismus. However, before moving on towards having the diagnosis, it is necessary for you to know the challenges you may come across while diagnosing dyspareunia caused by vaginismus. The challenges involved in diagnosis of vaginismus. You can easily diagnose your condition by simply visiting an experienced gynecologist. The gynecologist will conduct a gynecological examination to detect whether you are really suffering from vaginismus. However, some women suffering from dyspareunia, occurring as a result of vaginismus, may also find problems undergoing a gynecological examination. This is mainly because they are so terrified with the thought of someone touching their vagina that they close off their legs, making it almost impossible for the gynecologist to conduct a pelvic examination. If you really want to diagnose your condition, then it is essential for you to overcome this situation and allow the gynecologist to conduct the physical examination. The process involved in diagnosing vaginismus. There are two ways in which the diagnosis of vaginismus is conducted. These include medical diagnosis and a pelvic or a gynecological exam. When you visit a physician, he or she will discuss with you the location and severity of the pain you are experiencing. This will help you to have a correct diagnosis of vaginismus. The physician or the gynecologist can also ask you to undergo some other tests to know whether you are really suffering from vaginismus and not from a different sexual disorder such as vulvodynia or for some other reason. If you find it difficult to visit a physician or a gynecologist, then here is a step-by-step diagnosis chart, which can help you to self-diagnose the condition. Please, after you have finished watching the video, we advise you to look at the links in the description. There is something very important and useful waiting for you. Check if you are finding it difficult to have a vaginal penetration. If you are suffering from vaginismus, then you will find it difficult to have any kind of vaginal penetration. See if you are experiencing vaginal tightness. In vaginismus, there is a sudden tightness of the vagina while having sexual intercourse. If you are experiencing this tightness, then it means that you may be suffering from vaginismus. Check if you have any pelvic problems. If there is a persistent pelvic problem even after undergoing a treatment for a particular pelvic pain or medical condition, then it might be happening due to vaginismus. You don't feel like having sex because you find it painful. In vaginismus, a woman often avoids getting into any kind of sexual activity. If you are also not feeling good about sex or don't feel like having sex because it hurts, then it means that you may have developed vaginismus. These were some of the steps, which when followed, can help you to know whether you are really suffering from vaginismus. Remember, diagnosing vaginismus is not an easy task. However, if you identify all the symptoms and discuss all the problems you are facing frankly with your doctor, then you will be able to diagnose your condition correctly. Also, once it is confirmed that you are suffering from vaginismus, then you can also cure it by taking the proper treatment. In the end, please activate the bell button, subscribe to the channel, to receive from us all that is new. For more information about diagnosis of vaginismus, please visit my own site. You will find the website link in the description. Thank you.